Now, also marking the International Day Against Drug Abuse and Illicit Trafficking, we talked to the Mental Health Authority on impact of drug abuse and preventive strategies. I've been to some ghettos, and you know, when you see people, look, brilliant chaps, when you speak to them, brilliant chaps, some of them too very young, and you wonder what led them to the place and whether or not we can really get them out of the ghettos and rehabilitate them. So it's good that we're having this particular conversation, and to help us do this is Dr. Leanne Dede Sika Boateng, a specialist psychiatrist with the Accra Psychiatric Hospital, right? I got it right?
Yes,
yeah?
yes.
Okay.
Yes. So can we say Dr. Boateng? It's easier to remember. Okay. Welcome to the program. It's good to have you. I have a question. Drugs, I believe, are things that we take into our bodies to fix a problem. When you go to the hospital and you're not feeling well, your doctor prescribes a drug. At what points do these substances that we take into our bodies to help us cross the mark of helping fix something to becoming something that deters our mental well-being and gets into the abuse part? Draw the line between drugs that we're taking to help and then drugs that we take and it's not so good for us.
Yeah, that's a good question. So drugs, so we have drugs, we have illicit drugs, like when you go to the hospital or the doctor writes for you. And then we have the illicit drugs like cannabis, cocaine, all those other things are illicit drugs. So when we talk about drug abuse, when you are using the drugs in methods, so some people inject instead of taking that correct doses that they've been given, or in quantities that is not appropriate, or using it for situations or conditions other than what has been prescribed for. So for example, we hear red a lot, and it's an opioid. Opioid is for pain. So if you are using a medication for pain for pleasure, then that's drug abuse.
But what makes them sleep when standing without them knowing that they're sleeping?
So a lot of things happen when you start to use drugs in excess quantities, okay? So you have your brain actually rewiring when it comes to using, when you start using drugs, there are substances that are released, proteins that are released, that kind of rewires the brain. So now the brain is actually all into a network called the default mode network. Everything is about you. You sleeping, you eating, nothing about going to work, nothing about engaging in other activities. Your brain actually rewires to put salience on you. So then now you can be standing there, you are sleeping, all they think about is eating, when am I going to take the drug? Because now substances or things that make you happy, like food, sex, even social status, that increases dopamine in your system, makes you feel good, now becomes something very little. Now you have to use a drug to feel good, and that's the only thing that makes you feel good. So you actually kind of go all out looking for the drug, and then you start to have the physical and then the mental effects of using that drug.
I've read somewhere that drug abuse or people who have addictive personalities, it's not really about the drug or the substance they take. It's rather about some gaps in their social life or the environment. So for example, if you see, like we just played that promo of the, harmful doses also coming soon. The guy said he used to take it for strength, and now he can see that his strength is dwindling and he's about to die, So I guess the question I'm asking is exactly what constitutes that addictive personality so that you know and be on the lookout to completely stay away from drugs so you are on the safe side.
It's in phases, okay? When you start using drugs, for example, you're using alcohol, it's a illicit drug, all right? At first you can take a small tot and you're feeling good. Now it gets to a point where a full bottle will not give you that same effect. Just because your body is getting used to it, something called tolerance. So now you need higher doses to achieve that same effects that you used to have. So now when you're saying someone is dependent on a drug or addicted, I should say it, number one, they become tolerant to the drug. When they stop using the drug, they start to get effects. So you said that they start to shake, they're sweating, they're having abdominal cramps, they're not feeling muscle pain. They don't yes, they're having withdrawal, or it gets to a point where they are becoming, they focus only on the drug, so they're not going to work, they're not going to school, they're not talking to their families, everything. They don't mind falling in the gutter, they don't really mind whatever is happening. All they want is to get the drug. Now, when you get to that point where you realize that you cannot control how much you are taking, you cannot control the symptoms, that you have to take some of the drug to relieve the withdrawal symptoms that you are getting, or you are using more of the substance to get the same effect, then you say they are getting dependent on it. And that becomes a problem. So it's okay to use a little alcohol once in a while, but when you use it to a point where you wake up in the morning, you have to take it, otherwise you are shaking. Or when you don't take it, you are having seizures or convulsions, or everybody is talking about, everybody is saying, stop it, and you are still using it. You can't control yourself, then you said you are dependent.
Help me, Kojo, before you come in, understand whether or not it is true that there are some personality traits or there is just something about your genetic makeup that makes you more susceptible to addiction, whether it's drugs, alcohol, whatever. And there are people who don't fall in that category, because I know a good number of people who tell you that they don't even bother with alcohol because it doesn't do anything to them. And then you know people who have been drinking all their lives and they'll never cross the red line. And then you know people who tasted alcohol 1, 2, 3 times and now they drink themselves to stupor on a daily basis. So what is it about our genetic makeup that actually constitutes to addictive personalities?
Okay, so that's true. You can actually there are risk factors or etiological factors that predispose one to using substance more than another person. And yes, genetically, they've seen that we did some research and we saw that some people, especially alcohol, you can see it runs in families. Probably the uncles are drinking, daddy is drinking, everyone is drinking. And then genetically, they may have some DNA changes or genetic components that make them more tolerant to the use of the substance. Now it gets to a point where they become now dependent on it. And then it becomes a cycle. Now instead of the genetic makeup giving you a risk factor, you also have social factors. So you are seeing your father drinking, you're seeing your uncle drinking, you start to model it. The children now model it. So a child will look at the TV and see someone using sticks of cigarette, and now they are rolling and they're also copying it. So then that becomes a social factor. And then also we realize that some people, naturally, our bodies produce endorphins, or we have natural opioids in our bodies that make us feel good. Now, for some people, they have very little of that. So naturally, they are not happy. They don't feel good unless they take in something extra. And so, yes. And then sometimes, too, psychologically, people can be depressed, they are stressed out, or some people have social anxiety. They can't talk. They will say, I can't talk to you if I have not taken alcohol. That is a psychological problem, and that can also predispose you to using substances or getting you to the stage where you become dependent.
But are there red flags where one will see that I'm crossing the line?
Yes. So like the stages I gave earlier, you see that now you wake up in the morning, the first thing you're thinking about is I need my drink now, or I need to take a pill now. Because when you don't take it, you start to have withdrawal symptoms. So you are feeling, your mood is low, you are feeling anxious, you are feeling jittery, you are sweating, you're shaking. You know that if I don't take the drug, I'm going to go through this discomfort. So some people actually, when you get to that point, you say that you need the drug every day. Then you've crossed the line. Or when you say that everybody is talking about it, it's affecting your social life, your work life, your family life, then you know that, no, it's a problem. I have to stop now. Or you tell yourself, oh, today I'm only going to take 1 bottle. And then you find yourself taking 6 bottles. And that's a problem because now you've lost control. So when you see you're having loss of control, you're becoming dependent, you are taking more to get the same high you used to feel. 2 bottles used to make you feel so good. And now you need to take 6 bottles. Then you're crossing a line. So, yes.
As for these young people that I've seen, I'm not sure they will even be willing to say I'm crossing.
Yes.
We have to see it and offer the help. How do we prevent these things?
So we have to prevent it. So it's a whole lot of things to do. Okay, when we talk about prevention, we are talking about primordial primary prevention, secondary prevention, and tertiary prevention. So primordial, right from the womb, your mother has to be well, like eat well, nutrition is good, you know that your child is coming out, the brain, everything is formed well. Then primary, we want to make sure that the family systems are strengthened. You know, we've seen that people who were abused, emotionally abused when they're younger, or if they have family members who are smoking, they are drinking, they are modeling, they're going to copy that. Right from there, we have to prevent it from there. Primary prevention also, schools, we have to talk to the teachers, to talk to the students. They have to learn how to say no. You know, adolescence is a stage where a lot of people are ready to experiment. They can't say no because their friends will bully them. So learning how to say no, that no, I'm not going to take it because your mom has told you that this is going to be the effect. Your teacher is talking to you about it. We need to talk about mental health, substance use, and we don't have to hide these conversations. And then the mothers, when you notice or fathers, you notice that your child is falling into bad company or you're suspecting something, don't close your eyes on it. Don't pray it away. Confront the situation head on. Have honest conversations with them, and then we are preventing it. Now, secondary, you have to do screenings. So I know that there are screening, there are public screening methods going on where you get screened, you go through a questionnaire, we say, oh, you have a problem, we are going to help you. Or we get to the tertiary prevention where now the problem has occurred. They are using the drugs. So what are we going to do to stop them from using? They have to get all the help they need. It's not just, sometimes our medications we can give, then we have psychological tools we use on them, cognitive behavioral therapy, therapies to help you, 12-step, Alcoholic Anonymous, Narcotic Anonymous. There are groups that you can join. We have addiction units in most of our hospitals. Kolebu has an addiction unit, Accra Psychiatry, Pantine unit. We have OPD rehab. So OPD, you can walk in, do your rehab, and then go back home. Yes, and then we need to, at every point or at every stage, we need to do something to prevent the wild effects of using substances.
How effective would you say these facilities that you just spoke about are in Ghana? For example, when you watch, I'm going to reference this movie, Euphoria, because I think it's the most popular one that comes to mind about addiction. And you see that there are actually so many facilities, options for the high in society, the low average, where you can go and find the help that you need. But here in Ghana, I don't think I have seen anyone go for an AA meeting. I don't think I have heard anyone say that I'm going to check myself into a facility. I know there's a facility somewhere in Jawulu where I know that place, but how effective are these facilities? Does the average Ghanaian even know that you can go for rehab when you feel like you have reached the red zone? How effective are these facilities?
Yeah, so that's why you come in play. You have to talk about it.
Yeah.
Because we have facilities. There are so many facilities, rehabilitation facilities. We have some at Pantine. We have some at Accra Psychiatry, Ankafo. Rehab is going on. And a lot of times we even have people coming from other West African nations coming to use our rehab facilities.
Really?
Yeah. Okay. So mostly it's 3 months to 6 months stay. In-house, where we take you through the trainings, how to say no, our social cues, how to have good coping skills. So there are a lot of, and then the AA meetings, they are going on, but you are not seeing it because you are not really in that space. So the most important thing is you notice your friend has a problem, talk to your friend, bring your friend for help. Then you can
where do we find it? Because I'm sure somebody watching is wondering, where do I go? So where are these places?
In the hospital.
Where are the AA meetings?
We do it in the hospitals. We do it in the hospitals because it's a program.
So you mean you can walk to any hospital and say that you want to join the anonymous narcotic or alcoholic addiction, whatever?
You can walk in Accra Psychiatric Hospital,
Accra Psychiatric,
Pantine Hospital, and there are some few private facilities that when you enter, so I'm having a substance problem, we'll know what to do, what medications to do. We are going to take you through detoxification, support you, admit you if possible. Even if you don't have the money for admission, you can do outpatient. We have AA meetings going on, Kolebu, it's happening. all you need to do is to walk in and talk to us.
Okay.
You see, the point about the withdrawal,
Okay.
if I'm living in a house with her, what signs will I show for her to see that I am about to cross and therefore she has to act?
Okay. So withdrawal.
Because the one you gave us was me, to myself, that, oh,
Yourself.
now I'm craving for it. But if she lives with me, she might not know.
Yeah.
Are there signs that I will show for her to see?
Okay. So every substance and how they show withdrawal. Yeah. So some substances are called depressants. So they make you, like alcohol is a depressant. It will make you cool, calm, dull, but then when you're in withdrawal, you become agitated. The person will come there and shouting, or the person will start showing some aggressive behaviors, like I need to go, or the person may be angry easily, or triggered easily. So you can see that, no, this person's behavior has changed. The way the person is used to talk is changed. I know this person uses this substance. When was the last time you took it? So it could be that the person is in withdrawal. Or sometimes you see that the person is sweating. It depends. So something like the tramadol or the red, it's so common now. You said the person may be sweating, the nose will be running, they may even be excessively salivating. Yes, their heart rate, they will say that, oh, my heart is really beating fast, or they are breathing very fast, or they can even say, I'm having joint pains, my tummy is hurting. So you can actually say, oh, I know that this person has been using this. Why are you going through this? Hospital, just bring them and let's talk. And then let's talk about mental health. We are so hush-hush about it. We have to talk about, have open conversations. Oh, I see that you are using this. I know a friend, or I know someone who also went through this and is doing well. People who have gone through it also have to come out as ambassadors, and let's all talk about it and get everyone on board in helping the youth stop this pandemic, and then also support everyone who wants to get the help that they need. Let's stop the stigmatization. I mean, don't say that, oh, what dear, insana na wonoma na what dear, it's not a moral problem. It's a biological problem. There are brain changes, so they need support. It's a medical problem. They have to come.
You're saying addiction is a disease?
Addiction, perfect line. Addiction is a disease.
Yeah.
Yes, addiction is a disease. So it's not a moral thing. You can't pray it away in a prayer camp. Bible says faith without works is dead. So as you are doing your faith, come and let's add the work to it.
Addiction is a disease. So, I mean, I know you spoke about the triggers or what to look out for, but you also spoke about mental health, which makes me curious about how do you know that the substance you're consuming is affecting your mental health? So, for example, is there any point in the progression from just using a recreational drug to depending on a recreational drug to abusing the recreational drug, where your cognitive capacity is dwindling? Is there anything like that so that people know what to look out for in terms of mental health?
So WHO will say mental health is a state of health where one is able to know their own capabilities, know their own strength, is able to contribute to the society, is able to be productive, is able to work well and learn well. So now you're realizing that you're not able to work well because your mental health is going down. When you talk about mental health, it's how you act, how you feel, and how you think. So how the person is thinking is changed. The person is not thinking, I want tramadol now. The thoughts are changing. How all the conversations is about acquiring the drug, or they're not going to they're not going to talk at all. Or how they are behaving is changed. You see that how you behave. You used to be a calm person. Now this person is seeing things, talking a lot, is acting unusual. His mental health has been affected. Or how they are feeling. Now you're feeling, you used to be a happy person. Now you're feeling depressed. You're feeling sad when you don't take the substance. So, and then it becomes a cycle. Now because you're feeling sad, let me go and take the substance, let me feel better. And then when you don't take it, everybody's talking, now you feel sad. So it's a cycle we have to break.
But it doesn't affect how your brain capacity to function?
It does.
I mean, in terms of, you've linked it to social life. So maybe you used to be a bubbly person and now you're showing signs of depression. But how about like memory retention?
Yes,
How
you
about
used to, yeah.
yeah?
So you used so it changes your brain. So you used to be able to learn, now you can't learn. It means your mental health has been affected. You used to be able to think you used to get ideas. I had a patient, he said that, oh, I used to have a lot of ideas. I was very brilliant, but now I can't even think. Because now your brain has rewired that all you think about is the drugs. All you think about is how am I going to get it? I'm going to steal this person's phone. Now, no, crime increases, violence increases. I'm going to stab this person, take the phone, sell to get the drug. Everything is about the drug because your brain has rewired. There's something in the brain called executive network and a default mode. Default mode is all about me, me, me. Executive is work, other things, social, what people think about me, and all of that. Now, drugs change it. Now, instead of you focusing on the executive, you are thinking about default. Everything becomes about you. I'm going to steal this food to eat. That's all you're thinking about. I'm going to use this drug I'm not going to work. So a lot of them don't work. Unemployment rates high. So it's a whole cycle. It's affecting physically, it's affecting physiologically, and it's affecting mentally, and then it's affecting our society. Because now someone will break your car window to take your bag or something just to sell it to fund drug substance. Yeah.
So for communities where these kind of rehab centers aren't available, what can we do?
What we can do is let's talk. We have to, when we make a lot of noise, the government will hear us. They'll increase funding to mental health authority, the mental health institutions, so that we can increase capacity. We'll train more people in communities. We'll get more community centers where we are going to do OPD rehab in communities. So we have to talk. Now, currently, less than 2% is being allocated of the budget being allocated to mental health activities. So let's push for more so that our communities will have recreational centers. There'll be more work for them to do because it's a cycle. If I'm going to work every day, I won't have time to go and sit somewhere and go and experiment with red or tramadol. If I have recreational activities, I'm going to be happy doing those things instead of engaging in substance use, okay? And then if my community, I'm having a community health nurse, an advisor, psychologist that is coming every once a week, I know that I'm going to get the help I need right in my community. I don't need to travel all the way to Cape Coast or Accra or Kumasi to get the help that I need.
Can you recover or withdraw all by yourself? Do you necessarily need a community or a hospital to recover?
So I said that addiction is a disease. So it's a disease. So you can recover. I mean, there are some substances like cocaine. You can do cold turkey. You can stop at once. You get a few signs or even nothing at all, and then you get better. But then because it's a disease, your brain has rewired, it's very likely for you to fall back. So I have people who say, I stopped for 2 months and I started using it. I stopped for 3 months and I started using it because they don't have the coping skills. So when you come, we're going to teach you coping skills, anger management skills. There are so many skills that you learn at the rehab, or OPD rehab or inpatient rehab that's going to help you for life on how to prevent or stop a relapse. Now, relapse is part of the cycle. So even if you fall, you can still get up. You just need the right support. If you're coming home, your family is all insulting you, say, oh, you say, oh, they're red nan or benum, they are supporting you well, your community is supporting you, you'll be motivated, you know, to live a life that is clean and a life that is free of stigma. And then you are able to go and focus on other things. So come to the hospital. Let's support you as much as we can.
Are you saying that we should be kinder to people who are addicted to substances?
Yes.
Because it is a disease?
Yes.
Because I see how the people who are walking the streets who are probably high on stuff that nobody, like the red guys, and we treat them like they're others, you know, they're not part of the community. But you're saying that it's not their fault, bring them in so they can get the help that they deserve. Would you?
Why is it not their fault anyway?
Well, she's just saying it's.
I'm saying it's not their fault because it's a disease. I said their brain is rewired. Literally.
They went for it in the first place. They got themselves in there in the first place.
But you know, someone is 8 years seeing their daddy drink all the time to cope with stress. They are depressed. What will they do? They will go and take the drink because now when I take a drink, I'm going to feel happy. Parents have divorced, the home is broken, there's no support, there's no one taking care of them. Okay, their friends is going to talk to them. Oh, try this, it will make you happy. They're going to try. So it's not entirely their fault. You know, sometimes I had a patient who went to a party and their friends put something in a drink to make him happy because they said he's sad. And then now he's like, what did you put in? I want more of that. I want more of that. So it's not entirely their fault. Sometimes pain. You know, I had a patient, sickle cell disease. She takes it, the pain is away, it goes away. I'm feeling happy. I want this. So it becomes a cycle. She's going to Okaishi, she's injecting herself, even though she's having a physical illness. But it's the pain that drove her to that point. Sometimes people who had accidents, bone pain, they give you the injection. Oh, it's really helped, but it's also making me happy. I need that. They go for it. So it's not their fault, you know.
But I think majority is due to
influence.
Peer pressure.
Yeah. Exactly. That was a word.
Yeah.
You know. Yeah. Anyway, but as we celebrate today, is there any special event you are marking?
Well, I mean, I know the Narcotic Control Commission is doing something. They started Ghana Against Drugs, Red Means Stop campaign, and I think they're doing something on that. Yes.
So this conversation is just to create awareness that today is especially set aside to mark the International Day of Drug Abuse Day.
Yeah.
Okay, and so we're educating our audience and giving them some guidelines of London sports to look out on how to catch it, recover if you're already in it, get treatment and the help that you need. Yeah.
And also you can get this helpline down. It's a mental health authority helpline. So just in case someone wants to call, you don't know who to talk to, you need help, it's 0800 678 678.
0800 678 678. That's very easy. Memorize it so that if you or somebody else needs that help, you can call that helpline. Could you, unless you have more, I think we should be wrapping.
No, I'm just thinking about the people I saw standing, sleeping while standing, and what I can do personally. The point is that we can only talk to them. All right? There's nothing else we can do.
You can bring them together necessary help.
If they don't agree to even come with you in the first place.
But let's talk. When we make more noise, the government will put in more structures. There'll be more support for mental health and mental health related activities.
But also that this is related to unemployment. Yeah? Lack of jobs.
Yes.
Okay. Thank you very much.
Thank you for coming. This is Dr. Liane Dede Sika-Boateng, specialist psychiatrist at Accra Psychiatric Hospital. And actually, what you're seeing on your screen right now is someone high on bed.
That's it.
Why do they freeze like zombies? Why do they freeze?
Yeah. No wonder.
No, why do they freeze?
Their brain changes, literally. So they want to sleep. Why don't you walk to your room and sleep? No, I need to sleep now. I'm sleeping now. Yeah, so there are literally brain changes.
This is serious. What?
Well, be careful out there. Be careful out there. Don't fall. Kojo, you were sharing an experience about how they prescribed a drug for you because you knew it had tramadol content. You refused to take it.
So, you know, I'm still treating my malaria. Now, one of the painkillers they gave me, when I read the leaflet, it had tramadol and the paracetamol. I said, how could they give me this?
Okay.
So I didn't take it.
Okay.
But my pains became severe. And I said, oh, okay, maybe. Then I took it.
Okay.
Because of the pains.
Okay.
I would not have taken it.
Is that a window? Is that an introduction?
So that's where I started from. Drugs. What are drugs? So it's a illicit drug you've been prescribed. That amount you're saying is 37.5. That's very little.
Okay.
Yeah, it's very little. 37.5, you get the pain. Now these people are taking 250. Some are taking thousands. Some are taking 2,000 a day. When 37.5 is going to do the work. So when you use illicit drug in quantities or in methods that are excessive, you can, that's what becomes drug abuse. So you taking your medication your doctor prescribed for you is okay.
Oh,
it's just for 5 days.
I nearly walked to him to tell him, why did he give me that one?
It's just for 5 days. You'll be fine. You'll be fine.
Okay.
Well, thank you for coming. Dr. Lian, like I said, Dede Sika Boateng is a specialist psychiatrist at Accra Psychiatric Hospital. And remember, today is International Drug Abuse Day, so we are creating awareness. Thank you for coming.
But maybe just before, Doc, if those people tell you that if you give me a job, I'll stop, can you trust them?
So they have to get treatment.
Before?
You have to get treatment.
Else, even if you
because
get them a job,
addiction is a disease.
Okay.
So you have to go through some support. You need to get the support because they'll tell you, oh, do the job. They'll go 2 days and they are back to it because of salience. Their brain is rewired. So they want to stop. Sometimes they come up, try to stop, but I keep going back. I don't want to go back. What can I do? Then we'll give you the support. We detoxify, we do OPD rehab or inpatient rehab, and you'll be fine.
Okay.
Stay with us. Kojo and I return shortly for more on the AM show.
Bye.